Lower or bottom navel piercing. Pros, cons, advantages, disadvantages. We're going to go through 5 of each. Coming up next on Pros and Cons by a Piercer, Season 2, episode number 59. So you might want to stick around. For those that are new to the Body Piercing and Tattooing channel, welcome to the channel. Hope you're finding the videos interesting, informative, and all that fun stuff. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. The piercing we're going to talk about today is either a low or lower or bottom navel piercing. Basically, if you go into someplace, a piercing studio preferably, a reputable one, and say, hey, I want the bottom of my navel pierced, they're going to know what you're talking about. It is done through that natural lobe that's on the bottom with most people. Some people do have it. Some people don't have it. We'll get into anatomy a little bit later. And it's done with a curved barbell, either the navel style with the 2 gems on both sides or just a standard curved barbell. Now let's move on to the pros, the advantages, the things that make you go, yeah, this isn't a bad idea. Number 1, it enhances the beauty and look of the area. It kind of, especially when combined with an upper normal traditional navel piercing, it kind of creates this line effect of symmetry and kind of drawing attention to the area. Number 2, this piercing has a long history of healing. If taken care of correctly and you have the correct anatomy. This is not something that's extremely experimental. It will more than likely heal. Number 3, there is a huge selection of different types of jewelry you can put in a navel. Lots of additional things you can add to it, different gem colors, different styles, different colors, different materials, etc. There's a lot to choose from. The popularity of this piercing created a huge market for it, and there was a lot of jewelry produced, and still is, for this particular piercing. Number 4, doesn't affect lifestyle as much as other piercings would. This piercing is considered pretty much mainstream. It's not considered an extreme piercing. The bottom is a little bit more rare than the top would be, but most people out there are not going to be freaked out because you have your navel pierced. Most people consider it kind of a common piercing, so it's not going to affect your interaction socially. It's not going to, and it doesn't cause the issues that like oral piercings would with changing diet. It doesn't really change sleeping patterns as much as other piercings, so it tends to be kind of a more simpler piercing as far as the general effect of your life and lifestyle. And number 5, this piercing is easy to conceal. It's a piercing that if you work a conservative job or live in a conservative part of the world, it's easily to conceal, and nobody needs to know you have this piercing unless you show it to them on purpose. Now let's move on to the cons or the disadvantages, the things that make us go, nope, not for me. Number 1, long healing period. These can take anywhere from 6 months to a year to heal, if not longer. Navels are notorious for long healing periods, and for that reason, notorious for issues because people think they're healed and stop taking care of them. Number 2, the high-waisted pants. This is going to affect your wardrobe more so than even a top navel, normal traditional navel piercing would, because it's lower. It's going to come in contact with belt buckles, women's cut jeans, etc. a lot more than the top is. So it's definitely going to affect your wardrobe and what you are going to be allowed to wear during the healing process, and sometimes even after the healing process is over. Number 3, can't sleep on your stomach. You need to sleep on your side or your back. Number 4, you have to have the correct anatomy to get this piercing. Unlike the top, where most people do have a natural lobe there, things that might keep you from getting it done would be like your body type, your body size, how your navel is positioned, whether or not you have a crease there. And that could easily be solved by doing a floating navel. I don't know why that escaped me there for a second. However, with bottom, you really have to have that ridge. You really have to have something more of just a hole there instead of having kind of a more ridge on the top, and then the bottom just kind of is more gradual. A lot of people will have The top is perfectly pierceable. The bottom is it's almost like grabbing any other part of your body and trying to pierce it. Those are going to be more prone to rejection because they're more of a surface-to-surface piercing. You can't create those two sides. Not always the case, but you're at a higher risk of rejection and migration if you don't have that perfectly round kind of circle with that loose tissue all the way around it. And number 5, pregnancy and weight loss and gain. With anything that's on your stomach, especially piercings and tattoos, when you get pregnant or you gain a lot of weight or lose a lot of weight, it can affect the position and how that piercing looks and where it is at. It's not uncommon for them to kind of shift or move as your body changes during those periods of time where the piercing was in one spot, and then by the time you reach the end of it, it's in a different spot. So it's one of those things you need to consider. Also, during pregnancy, you may need to remove this jewelry, probably because it's not going to heal. It's going to create giant holes, basically, and it's not going to look as good once you're done with your pregnancy. So I generally suggest just removing the piercing, letting it heal, and then redoing it once you're at a point in your life when you're no longer going to have any more children. Now let's talk about things you want to look for beforehand. You should find a piercer that's experienced, professional, informative, makes you feel comfortable, offers a consultation without being asked to, that covers aftercare, risks involved, it looks at your anatomy and figures out what's going to work best for you and helps you through the process of picking the proper jewelry. And they should have the proper jewelry. This one should be done with a curved barbell. It really varies from what the shape of your navel is and whether or not you have one existing navel piercing already. If you have a large setting on the bottom of your navel and you have your top navel done and it takes up the entire navel, then, yeah, you're going to have to change jewelry to maybe something a little bit more simplistic, either a disc back or something with a very small end. Another thing you should consider is you're not going to be able to wear women's cut high-waisted pants. They came back into style a few years ago. That constant rubbing and agitation is going to cause issues. You can't cover it up with a Band-Aid and make it feel good and all this other stuff. It's the pressure and the constant movement and shifting of that jewelry that's going to cause issues. Things like hip huggers, men's cut jeans, bibs, loose-fitting clothing like leggings or tights, those might be okay and probably going to be your best option. But you need to plan ahead on that one. The other thing is, does your piercer provide aftercare products? If not, where can you get them? Are they going to go through the aftercare instructions with you and explain how to clean and maintain the piercing? Now let's go through the piercing experience itself. First off, there's a consultation during which your piercer will talk to you about what it's going to involve to heal the piercing. Generally, they'll talk a little bit about if there's any risks involved. They'll look at your anatomy and see if you're a good candidate, and talk about whether you're more prone to migration or not, or what have you. And then they're going to go through a jewelry selection and pick the best piece that's going to work for you. Now, if your anatomy is not suited for this piercing, it's usually best just not to get it. You're going to end up with scarring. And if your anatomy is kind of on that borderline and you start to see any type of issues of migration or rejection, your best option is always to remove the jewelry as soon as you start seeing that. That's going to cause the least amount of scarring. Next up, you will go through usually a waiver where they'll ask you a bunch of questions. You have to fill out a form and then sign it in blood sometimes. All right, no. Not in blood. You normally don't. It's usually on a tablet, at least most places nowadays. Then your piercer will begin doing the setup. They will set up a sterile field, so to speak, or a setup area, and then they will slowly begin to unwrap and set up all the equipment they will need to do the piercing. Now, after you've gone through the waiver and they've gotten set up, they'll disinfect the area, usually using a surgical scrub such as providine iodine or Hibiclens or some type of surgical scrub. Once that has become effective, they will clean off the area, usually with some saline solution, and then mark the piercing. Now, the piercing should be marked while you're standing, and this is because this is When most people look at their navels, they're going to look at them when they're standing. When you're laying on your back or when you're sitting, that tissue tends to be in a different position. So marking it when you're sitting or just clamping it or just doing the piercing without marking it, not a good idea, not somebody that you want working on you, in my opinion. Once it's marked, they'll put you in a reclined position. I personally prefer to do these with forceps. So Pennington forceps. I'm not a big fan of doing freehand navel piercings. If anybody wants to get into that debate, we're welcome to do that in the comments section. Let's not bore everybody else with it. Once they're clamped, usually we'll have you do a breathing exercise where you smell the cake and then blow out the candles. And then the piercing is done during that blowing out part, usually. Needle goes in and through. The jewelry is usually attached to a guide pin. It goes through. You take the guide pin off. You've removed the forceps at some point in there. And then screw the end on, and then you're done. Usually there's not a lot of bleeding involved with this piercing. There's not a lot of blood vessels in that part of your anatomy. It's also usually not a very painful piercing to get done. Most people say on a scale of 1 to 10, it's a 2. The bottom can be a little more sensitive than the top. That's not uncommon. But for the most part, there's not a lot of nerve endings closely packed together down there. So chances are it's not going to hurt that much. Usually right afterwards, you'll have a little bit of throbbing and aching. Then it's going to be tender to the touch, possibly some redness, discolorization, heat, tender to the touch, anywhere from 3 to 5 days after the piercing has been done. Usually, if you bump it, you're going to know it, and that's your body training you not to bump it. Leave it alone. Healing. Average healing time on this is going to be anywhere from 6 months to a year, during which time I'm going to suggest that you clean twice daily using a sterile saline spray. Personally, like Neomed's Piercing Aftercare, it comes out in a fine mist. You just mist the area, let it stay in contact for about 5 minutes, pat dry any excess. If you're using the kind that comes out like a squirt gun, then you need to use a cold compress method. Take a sterile piece of gauze sponge, saturate it, or if you don't have one, a gauze, try a clean paper towel, and then lay it against the area for 5 minutes, pat dry. You want to do that twice daily. Basically, the other thing I suggest doing is at the end of your shower, stick your belly out and let the water flow over the area for about 30 seconds at the end of your shower. What we're doing with those two things is we are removing that limp discharge, the crusties, the things that harden on the jewelry. And the reason we want it off there is as the piercing will move and shift as you move, we don't want it to agitate the piercing and cause issues. Now, if you have an excessive amount of discharge or it doesn't seem like it wants to come off, go see your piercer. Have them clean it for you. There might be some other issue going on at the time, so it usually is best to go see them and have them clean it and take a quick look at it. Now, you're going to need to practice cross-contamination prevention. Common sense things: washing your hands before you handle it, no oral contact, no exchange of bodily fluids, keeping your environment clean, clothing, bedding, towels. Do not submerge the piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. No swimming, in other words. Keep pets away from it. Don't let them sleep in the bed with you, especially under the covers. Avoid playing with the piercing. It's not a fidget spinner. It's not a new plaything. Leave it alone. The only time you really need to have any contact with that piercing is when you're checking the tightness of the ends, which I generally suggest doing once a week. You don't need to get out pliers. You don't need to buy Loctite. You just need to check them occasionally. Now let's talk about jewelry. You should leave the jewelry in the full time until it's completely healed. If you have been piercing with an excessive, a longer piece to allow for inflammation, or maybe your piercer was concerned about that, then you probably need to downsize in roughly 4 to 6 weeks, especially if it starts getting caught on everything it comes in contact with. If it's just like a big arm out there, finger swinging around, getting hooked on things, then you do need to downsize. Avoid removing the jewelry at all. Leave it in at all times. The longer you leave the jewelry in, the better off you're going to be. It's not a bad idea for the first year or year and a half to have it professionally changed. We have tools to do that, and we're less likely to cause damage, and we're definitely going to get that jewelry back in for you. Avoid jewelry that has sharp edges, points, or things that dangle off of it that tend to get caught on things. Think about the clothing you wear and where that comes in contact with that jewelry. And if it is going to come in contact with it, what it's going to feel like if it gets caught on it. Your best jewelry option on this one, of course, is curved barbells. Simple, easy to maintain, best option. Some people find the flat back labraze style on the inside, or the top in this case, the best option, but experiment and see what works best for you. Now let's talk a little bit about living with a piercing. Jewelry should be left in at all times. I know I've said that about 7 or 8 times now. Be very cautious with clothing. Experiment at first and see what you can wear and you can't wear. Jewelry directly in contact with the piercing, especially very tight jewelry, can cause issues even in a healed piercing because it's causing trauma and can cause tearing. So be careful. Take your time. Kind of experiment with it and see what's going to work or not. As I mentioned earlier, I generally advise if you do get pregnant just to remove the jewelry. It's going to probably, by the end of it, there's rare occasions where I have had clients that have worn it all the way through, and when they got done, it looked just the same as it did before they started, but they are an extreme rarity. In most cases, it'll move a little bit to one side or the other, or the holes will end up, the entrance holes will end up extremely large, so it'll look like, it's stretched out to like, I don't know, 4 gauge. So it's always best. You're dealing with a lot of things during that period of your life. Just remove the jewelry. When that part of your life is over, have it re-pierced. Speaking of which, let's talk about abandoning the piercing. If the piercing is completely healed, there's really not much you need to do. Just remove the jewelry, and your body will slowly begin to reconnect the tissue and close the piercing. Kind of shrink it from the inside and then fill it from the inside outward. It will appear open for probably a number of years. That's not unusual. It's not something you need to be concerned about. Sometimes when you squeeze the holes, you'll see this kind of gross, waxy, yellowish stuff come out of it, and it smells really bad. That's sebums. It's a natural oil that your body produces that keeps your hair follicles moisturized and also makes you waterproof. It's normal. Leave it alone. It doesn't mean it's infected. Now, if the piercing isn't healed yet, it shouldn't be an issue to remove the jewelry if there are no signs of infection or other problems. If there are signs of possible infection or other problem, go see your piercer or seek medical advice before removing the jewelry. If you remove the jewelry and the piercing is in fact infected and the infection is deep inside the piercing, there's always a possibility that once you remove the jewelry, the body seals up the entrance and exit holes and traps that infected tissue and fluids deep inside your body, causing your body to do one of two things. It'll either, basically one thing. It'll isolate the tissue by developing either a cyst or an abscess and then slowly push it to the surface or attempt to do so. And then it will more than likely need to be lanced and drained. So it's always a good idea if you have problems, check it out or have your piercer check it out just to be on the safe side. But that's all I have to say on bottom navel piercings today. Hope you learned something. Hope it helped you make that decision maybe a little bit easier for you. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video. Maybe this one.